Hi there. I'm just preparing a lecture actually on prematurity that I'm about to give in a week or two's time for my postgraduate pediatrics osteopathic group. And I was just looking into reading and thinking about this thing called Kangaroo Mother Care, KMC. And I just wanted to do a little chat on it because it's something that's very, very interesting. Kangaroo care is a group of practices around the care of newborn babies and especially of preterm babies, premature babies, that completely makes sense. It's so important. This was developed in the mid-1970s by a guy who was actually watching how marsupials, especially kangaroos, care for their babies and brought that into some sort of understanding of how to care for newborn babies, especially premature babies. So this kind of, the basics of this care is that the baby wears just a small nappy and is wrapped tightly around the mother or the father or the caregiver. It doesn't actually matter. It's obviously great for it to be the mother because it actually connects up with breastfeeding and increases breastfeeding. So the baby has this skin-to-skin contact. So it's wrapped around the chest of the mother or of the father, and all the time. So the baby is carried right close to the chest so it can hear the heartbeat, feel the warmth, the skin is stimulated, bonding is connected, is stimulated straight away. This has a huge, huge effect on many levels, now especially when you're dealing with premature babies. Premature babies, first thing you have to do is stabilize temperature, because premature babies have not so much subcutaneous fat and they're prone to water loss because their skin is not so developed. So their temperature control is much more hindered, so they need constant warmth. And that's why they're in incubators often, and they're in highly temperature controlled environments until they get stronger. But when they're wrapped around mother with skin-to-skin contact, their temperature is perfect straight away. The other side of it, I mean, there's many sides to this. There is, the baby is getting auditory stimulation. They're hearing the rumblings of the father or the mother's voice, the heartbeat, which helps to regulate their own heartbeat. What this tends to do is stimulate and have a positive effect on breastfeeding. So actually, breastfeeding quality and ability is directly improved. Production of the milk is better, has been proven to be better with kangaroo feeding. Also, one of the biggest sides of this is the bonding effects, because a premature baby or any baby has been inside mum in a very warm and very fluid environment where they've actually heard these voices and had this connection at all periods of time. So bringing them back into the closest to being in utero again has a huge effect, and it actually literally produces more oxytocin, which is the love or the bonding hormone. And it increases them in the mother or caregiver and the baby at the same time, which is amazing. And so what this actually does, oxytocin has a huge array of effects, but it increases empathy, it increases milk, it actually produces the letdown response of milk, oxytocin. That's a direct effect of it. It has a direct effect on maternal or caregiving characteristics, including empathy. It has an effect on decreasing fear and anxiety. It actually also can even reduce inflammation because it has an effect on cytokines, part of the immune system. So you've got this array of effects of oxytocin, which are enhanced and increased by this skin-to-skin contact, this connection, this bonding, this constant bonding. What's interesting is that the World Health Organization right now have put out this new thing where they're trying to increase the global rate of kangaroo maternal care, KMC. So their push is for, basically the rate right now is 1% globally that this is being used in all babies. They're pushing for 50% of this, of the world of newborns, to be looked after in a kangaroo care fashion by 2020. They estimate that this would save an estimated 450,000 lives per year. Actually, they have, which is interesting if you want to look at this, there's a downloadable book called KMC, A Practical Guide, which is available online from the World Health Organization, which looks at practice and detail of how KMC works. So the interesting thing is, in certain parts of the world where they introduced it, for example, in Bogota, in Colombia, there are certain hospitals, because of the great poorness and the lack of conditions and lack of funding, they actually release babies that are classified as low birth weight infants, which are 1,000 grams, tiny little babies, for whatever reason. They will set up a kangaroo care system, teach the mother how to do this, and send them out, straight away. So the other very important side of kangaroo care is that actually the baby is discharged earlier, they're sent home earlier, which of course is huge in the developing world. And also the likelihood and chance of infection is much better. In fact, actually, the research around KMC has a lot of effects. The temperature of the baby is normalized, the heart rate is normalized quicker, respiration is normalized quicker, they have fewer infections, they have quicker weight gain, the sleep patterns are improved. The interesting thing is, when a baby is moved around and is stimulated, it stimulates part of the brain called the vestibular apparatus, which actually has been shown to aid cognitive development. So if you've got a premature baby who has a tendency to neurodevelopmental issues, they are minimalized by kangaroo care. Okay? Decreased cortisol levels, which are stress hormones, both in the mother or the caregiver and the baby. There is a reduced pain response, so they have less pain. They have a less tendency to colic, actually. So there is some research on a reduction in colicky symptoms with this kangaroo care. We've talked about bonding and breast milk, and the breastfeeding, of course, is a huge subject which we can talk about another time. And motor development. Motor development has been shown to be improved by this. So ideally, the ideal situation in normal term babies is to introduce this kangaroo care, so you strap them tightly to you within an hour, within the first hour, which sets up bonding, breastfeeding, all these processes that are naturally interlinked. Obviously, in a preemie baby, they have to be stabilized first. And in a premature baby, it's suggested that actually the premature baby, especially early babies, are kept in this situation, most of the time for 6 months, and with normal term healthy babies, maybe, the first month or two, to be like that a lot of the time. It's a huge difference in how our society has thought about care of the newborn, because if you think about it, a baby is put in a cot, put away from the parent, so they're not feeling this skin-to-skin contact. So there's this fundamental sense of loss of connection immediately, not helped, of course, by bottle feeding, etc., etc. So we need this fundamental connection and this skin connection, and it has a huge effect on so many different systems of the body in terms of normal development and fluidity and function of the organs, in my view. So for me, it's a very beautiful thing, and actually, it's not a new thing, because there are certain tribes, especially in Africa, that have always done this. This is the normal situation. But nowadays, what's the most interesting thing is there's a ton of research that's supporting this. So anyway, it's food for thought. Thank you.